On this Sunday night, Canada's place in the vaccine lineup. The delays of doses.
Extra beds is like a Band-Aid. What we really need is a vaccine.
Are more options imminent for Canada? The concerns the pandemic could worsen.
Those variants could overtake and lead to a much more devastating third wave.
And how to prevent it. A New Zealand woman tests positive for COVID-19 after the 2-week quarantine and heeding the call for help.
I thought, oh, that's my thing.
The medical professionals coming out of retirement.
Global National with Robin Gill.
Good evening and thank you for joining us. It's going to be a tough week on the vaccine front. No new doses are arriving from Pfizer-BioNTech. The Prime Minister says he's received assurances from the company that it will follow through with deliveries when production gets going again. But a member of his cabinet and a close confidant of Justin Trudeau is hinting 2 other vaccines could be approved in the near future. But will it make up for the delay? Abigail Bimman has our top story.
I spoke with the global CEO of Pfizer, Dr. Bourla.
A conversation that didn't change the fact Canada will get 0 doses of the Pfizer-BioNTech vaccine this week.
The next few weeks will be challenging when it comes to deliveries.
According to the federal government, as of last Thursday, more than 1.1 million vaccines were distributed to the provinces and territories. And according to the Global News Vaccine Tracker, by Sunday, a little more than 800,000 of those were administered. On the world stage, Canada continues to drop in terms of vaccine rollout, now ranking in 18th place, right behind Italy and Romania.
Extra beds is like a Band-Aid. What we really need is a vaccine.
We are in an international competition for a very scarce resource.
On the West Block with Mercedes Stephenson, the Minister of Intergovernmental Affairs said the government is trying to get Moderna doses earlier.
Whether they can bring forward some doses that may be coming in April, could we get them in March? Some of the ones that were coming in March, could we get them in February? So those conversations are ongoing literally on a daily basis.
Dominic LeBlanc also hinted at a timeline to approve the next 2 vaccines.
We're very hopeful that in the coming weeks, other vaccines may be approved by Health Canada as safe for use. AstraZeneca, perhaps Johnson & Johnson thereafter.
Coming weeks for the 2 vaccines under rolling review by Health Canada. Both are more traditional vaccines than the new mRNA technology used for Pfizer-BioNTech and Moderna, meaning the world could produce more fast.
They can use industrial processes that we already have a pretty good handle on. They're the type of things that can be made in large batches and for lower cost than something like an mRNA vaccine.
Canada's top doctor is asking all Canadians who are vaccinated to keep following guidelines, including mask use and physical distancing, in part because Dr. Theresa Tam says while the vaccine will stop you from having COVID-19 symptoms and getting sick, we still don't have enough evidence as to whether it stops you from transmitting the virus to someone else. Abigail Bimman, Global News, Ottawa.
There are concerns that new, highly contagious variants of COVID-19 could push Canada into an even more dangerous third wave. Some health experts say more aggressive steps need to be taken, and the clock is ticking. Katherine Ward reports.
We've got a chance in Canada because it hasn't arrived in huge numbers here yet, but the window's closing.
Even though thousands of tests for COVID-19 happen every day in Canada, that is not the case for the new variant, commonly referred to as B.1.1.7, or the UK variant.
We look at about 3 to 5% of cases, but we're going to miss at the moment 95 to 97% of these variants when they appear in Canada.
A second sequencing test is needed to confirm if a COVID-19 case is the B.1.1.7 variant. At the moment, that is only being done when it is highly suspected. This was the case at the long-term care home in Barrie, Ontario, just north of Toronto, where officials say nearly all residents and staff have tested positive.
We've had a preliminary test showing a mutation that was consistent with one of the variants of concern. Now we know that the variant in this question is the UK variant.
And on Sunday, another case of the UK variant with connections to a long-term care home was confirmed in Bradford. Officials say countries that do the additional sequencing will have a clearer picture of what they're dealing with when it comes to the spread of the virus and be in a better position to get the pandemic under control.
There's much more sequencing going on in England. That's really why we discovered this variant. And other countries like Denmark announced this week they're going to now sequence every positive case.
Experts warn if more is not done, this highly transmissible form of the virus could quickly get out of control.
As this gets into places where there's vulnerability, there's going to be a significant amount of spread. And yeah, there's going to be hospitalizations and unfortunately deaths.
Those variants can grow exponentially in a background, even where cases are decreasing. And that's a real concern because those variants could overtake and lead to a much more devastating third wave.
Katherine Ward, Global News, Toronto.
Ontario and Quebec remain the COVID-19 hotspots in Canada, but a promising trend is starting to emerge in Quebec. Daily case numbers and hospitalizations are declining. But as Tim Sargeant explains, it is still a time to be cautious because only 2.5% of the province's population has been vaccinated.
The impact of the government-ordered lockdown is still clearly evident. Most Montreal stores, malls, and restaurants remain shuttered. Quebec's premier is lauding the benefits of the overnight curfew. The extraordinary measure, the first of its kind in Canada, has been in place since January 9th. Daily COVID-19 cases and hospitalizations are dropping, but the number of patients in intensive care remains high, and the death toll continues to climb.
It's always difficult to see somebody die.
Dr. Jean-François Lisée is the ICU director of a leading teaching hospital in Montreal. He says this is no time for Quebecers to let down their guard or for the government to ease restrictions.
We'll still have to do what we did for the last nearly year and protect ourselves because the virus is still there.
Montreal police broke up 3 large religious gatherings this weekend, all of them occurring at synagogues attended by the city's Hasidic Jewish community.
The police acted appropriately from everything that we've been told and everything that we've seen and heard. And it's a source of pain to the Jewish community, what happened.
The fear is that large public gatherings like these can become super spreader events.
You might be doing something for a very good reason, but that doesn't matter in terms of viral propagation. So I think we have to be mindful of the fact that anytime people get together, there is a risk of viral spread.
Administering the COVID-19 vaccine is the government's strongest weapon in its battle against the virus. To date, all seniors in public nursing homes have received a first dose, but in the rush, an error. 97-year-old Antonietta DiBiase received the Moderna vaccine at her nursing home, but when she moved to a different location, her second dose was a Pfizer vaccine. It's a combination that is not recommended by pharmaceutical companies or public health officials.
Whoever's giving out these vaccines is the one who should be blamed.
So far, only 2.5% of the Quebec population has been vaccinated. For now, the curfew and lockdown measures remain the key to containing the COVID spread.
We don't want to open things up and have the numbers climb again.
The government-imposed restrictions are scheduled to be lifted on February 8th, but that date could likely be extended. Tim Sargeant, Global News, Montreal.
A family which came to Canada as Syrian refugees is mourning the death of their 19-year-old son after he contracted COVID-19. He worked as a cleaner at a long-term care home where several residents have succumbed to the illness. As Morgan Campbell reports, an investigation is now underway into the young man's death.
Yassine Debay was a cleaner at the Middlesex Terrace long-term care home outside of London, Ontario. He died last week after contracting COVID-19.
This has totally broken my heart. It's pain after pain, tragedy on tragedy.
Mohamed Faki is a well-known business owner in the province and has deep roots within the Islamic community. He is also one of many people across Ontario feeling the effects of Debay's death. At 19 years old, he is the latest person under the age of 20 to die with COVID-19.
Of the 19,000 people that we've had die due to COVID, only 3 of them are 19 years and under. So this is three deaths out of 19,000. So it's extremely rare.
The teen was a contract cleaner at Middlesex Terrace. In a statement, the CEO of the home's parent company offered condolences, writing, "We extend our deepest sympathies to the family and friends of Yassine. Out of respect for their loss and grief, we are declining any interview or statement requests at this time."
Global News has learned that the teen was a Syrian refugee arriving here in Canada back in 2016. The Islamic community has come together in support support of the grieving family, covering all costs associated with the funeral.
The Middlesex London Health Unit has confirmed an investigation is underway to determine if the teen had underlying health conditions.
A person of this age diagnosed with COVID would rarely have a fatal outcome such as this, and so it certainly is saddening and tragic.
DeBay's death comes at a time when the province is grappling with outbreaks in more than 250 long-term care homes. Middlesex Terrace is currently battling an outbreak at the 105-bed facility where at least a dozen seniors have died and more than 50 residents and staff members are infected.
Many could have been prevented with adequate staffing, adequate care levels, adequate infection control, and PPE.
Advocates say the latest death is troubling. In all, 11 LTC workers in Ontario have died from the virus, in addition to more than 3,300 residents. Morgan Campbell, Global News near London, Ontario.
To the U.S., where an astonishing 25 million people have been infected with COVID-19 since the start of the pandemic. And there is growing frustration among Americans waiting to get their shot. But the White House is asking for patience. As Jennifer Johnson reports, the new administration is optimistic about its vaccination plan.
It's really horrible.
Frustration across America as COVID-19 vaccines run out. With no notice, this woman's appointment was canceled in Brooklyn.
There was like no signage on the street. This is where we are, or we're canceled.
Depending on which state or even which county you live in, dictates who can get the vaccine right now and who can't.
Retired surgeon gave me my shot, so I'm very happy.
Under the Trump administration's rollout plan, it was every state for itself, but that is changing with the new president. The Biden administration has a new federal plan, but facing a multitude of challenges.
We need more vaccine, we need more vaccinators, we need more vaccination sites. And in the Biden administration, we're tackling all three.
The Food and Drug Administration has just approved new special syringes that can extract one extra dose from the Pfizer vials, adding more shots to the supply. Meanwhile, despite Republican opposition, Democrats think they can get the president's new $1.9 trillion COVID-19 relief package passed as early as next month.
We've got people with pre-existing conditions that have been literally isolated for nearly a year waiting for help with this vaccine. Of course, we need the funding to get that vaccine distribution out there. We got to stop messing around and get our economy going again.
The president spoke with U.S. governors this weekend, asking them to push their residents to wear masks as they get this vaccination plan up to speed.
Masks, not vaccinations, are the single best defense that we have. Medical experts say that by wearing masks from now until April, we will save more than 50,000 lives.
The Biden administration trying every defense possible against this virus, knowing that hitting their 100 million vaccination mark will take months to pull off. Jennifer Johnson, Global News, Washington.
For the first time in more than 2 months, New Zealand is reporting a case of COVID-19 after the patient in question was quarantined for 14 days. The 56-year-old woman had recently returned from Europe, and during the mandatory 2-week isolation period, she tested negative twice. Health officials are now conducting genome testing to confirm if her case is a more transmissible variant of the virus. Coming up, getting 11 miners trapped 600 meters underground out. One by one, 11 miners were rescued today in eastern China. They had been trapped for 2 weeks after the explosion at the gold mine in the province of Shandong. Rescue crews had been communicating with the miners and lowered food and medicine to them through lifeline holes drilled through the rock. But the ordeal isn't over yet. The condition of 10 others trapped in another part of the mine is still unknown. And sadly, one person injured in the initial blast was confirmed dead today. At the start of the pandemic, retired nurses answered the call to return to the front lines and help save lives. Now they're needed again to improve sluggish vaccine rates. Ross Lord explains.
The effort to vaccinate more Canadians faster is touching off a different kind of call to arms. And among those heeding the call are retirees who thought their days on the front lines were over.
I thought, oh, that's my thing. I would really appreciate doing that.
Teresa Anderson of Sarnia, Ontario, came out of retirement. Suddenly, she's working full-time hours, driving more than an hour to London each day to vaccinate grateful recipients.
I've never really had this in my career before, where people just literally run towards you, run to you to get that vaccine. And they sit down and they're just so happy and relieved that they're getting this injection.
In Nova Scotia, this union leader says she's ready to get up from her desk and into a vaccination clinic.
We should do our part and volunteer to do immunizations, and that's what I've done. I've completed the education component as a refresher.
As an incentive, the Nova Scotia College of Nursing is waiving fees and relicensing nurses faster than ever.
This is just a wonderful opportunity that we're hearing from these retired nurses, how thrilled they are to have this opportunity.
I wanted to be part of that and to be able to support our community getting vaccinated, and for us as a society to get back to whatever level of normalcy we will have post this COVID era.
The college says in the past week alone, roughly 200 nurses have applied to return, a movement that's growing across Canada as the push for protection intensifies. Ross Lord, Global News.
Still ahead, a single rocket breaks a ride-sharing record.
On your marks, get set, go!
People across England spent the day enjoying a rare snowfall despite current lockdown measures. Parks were filled with kids and some adults sledding down hills. Many people were not wearing masks or physically distancing, but at least one snowman spotted near Buckingham Palace was sporting a mask. The snowfall forced several COVID-19 testing and vaccination centres to shut down. So far, more than 6 million people across the United Kingdom have received their first dose of the vaccine. Our Europe Bureau Chief Crystal Gomansing has a look at the race to vaccinate in the UK and around the world.
From cathedrals to cinemas, vaccination centres have sprung up around the UK.
Strange, but it's strange times, isn't it? Nice and open, plenty of space for everybody.
Boris Johnson's government is aiming to vaccinate 15 million in the over 70 and high-risk group by mid-February. The urgency more acute now that there's some suggestion the UK variant may also be more deadly.
Like in Canada, there are also supply issues here. Some communities are having their vaccine shipments diverted to other neighborhoods. The goal is to balance coverage, but it is frustrating for people.
If we think about this as being kind of a wildfire, if we're all kind of going at this with with our individual jerry cans or our hoses and trying to kind of put things out piece by piece, we're not going to make a lot of progress. I think we have to think about this as being a non-competitive race.
In countries with robust vaccination campaigns, the UK and Israel, for example, infections, hospitalizations, and deaths remain very high. Researchers in Israel grabbed headlines saying early data from some older individuals vaccinated with the Pfizer-BioNTech vaccine suggested single shots may not provide as much protection, possibly only lowering the risk of infection by 33%. Pfizer-BioNTech has not released any single-dose data. Its trials were based on 2 shots. The comments have since been refuted by Israel's Minister of Health, saying the information was taken out of context and that more time is needed for the vaccine to take full effect. Still, officials in Quebec took note. They're watching for more information, but for now, the province's vaccination strategy is not changing. The problem is there's little concrete data. Research is ongoing.
It's been somewhat frustrating, I think, for most of the research community kind of watching this kind of science by press release.
Teams around the world need time as they work to sort out questions about vaccine effectiveness and the role coronavirus variants play. Public health experts continue to say vaccines are a key tool, but not a silver bullet, stressing the need for people to take precautions.
Still keep yourself safe, follow all the guidelines.
If I stay indoors much longer, I should go stir crazy.
It's for everyone's safety.
Being safe will keep the virus from spreading. Crystal Gamanson, Global News, London.
SpaceX achieved a record-breaking rideshare today after it launched 143 satellites into space, the most ever carried by a single rocket in history. In the process, the Falcon 9 rocket deployed 10 of the company's own Starlink satellites as part of SpaceX's ambitious satellite internet plans. After completing its mission, the rocket safely landed back on Earth on the same day. Up next, the loss of a Leafs legend, George Armstrong's role in hockey history.
Is off now. Armstrong shoots, he scores! Armstrong.
Toronto hockey legend George Armstrong has died at the age of 90. Armstrong spent his entire NHL career with the Maple Leafs. He captained the team to 4 Stanley Cups in the 1960s. Armstrong was one of the first players of Indigenous descent to play professional hockey. He was inducted into the Hockey Hall of Fame in 1975. A boy in New Brunswick is getting big league attention for a small-scale Zamboni. 5-year-old Nicholas Alain went viral for cleaning his family's backyard ice rink with this improvised mini Zamboni made by his dad. The video's popularity has snowballed on social media, even catching the attention of the NHL. It shared the image on its Instagram page. And that is Global National for this Sunday. I'm Robin Gill. We leave you tonight with getting cold for a good cause.
This is how we do a snow challenge in Alberta, Canada.
These Canadians are making snow angels in swimsuits and daring others to do the same to raise awareness for the Heading to 2022 campaign. The goal is to raise money to help researchers find a cure for diabetes. Thank you for watching. Donna Friesen will be back here tomorrow. I'll see you next weekend. Have a great night.